In medical news, a report from the Centers for Disease Control and Prevention says only 30% of Americans with HIV have the virus under control. Dr. Fiona Gupta is a neurologist and medical director of the Deep Brain Stimulations program at Hackensack University Medical Center, and she joins us here in our New York studios. Welcome to Arise America, Dr. Gupta. Appreciate that. You know, I'm actually a little surprised by this statistic. Why are only 30% of those with HIV have their virus under control? Why does that happen?
Oh, it's absolutely astounding, especially with the leaps and bounds we've made in treatment over the last couple decades with HIV, that only 30% are under control. And there's a couple of different reasons why. Many patients initially seek treatment, but then they're lost to follow-up, or they don't continue to, receive medical care. And actually, many patients don't even know they have it. They're just not diagnosed. So many different reasons, but it's really important to treat patients. Probably
20, 15 years ago, there was this big push for getting tested for HIV. Know your status. Do you remember that campaign?
Exactly.
And that seems to have died off. And it seems to be showing up in the statistics. So talk about, other than the obvious reasons, why treatment is so important for those who are HIV positive.
So, treatment, responsible treatment for an HIV patient actually has been shown to reduce sexual transmission by 96%. So this is why it's absolutely crucial if we want to eradicate this epidemic. And I agree that education really is paramount in not just with patients, but also amongst caregivers and physicians to make sure patients are being treated.
Yeah, so important to do that. Know your status and then behave accordingly.
Correct.
Let's change the subject and talk about another study that talks about brain morphology or structure of the brain and sudden infant death syndrome known as SIDS. What are researchers finding in this regard?
Sure. So sudden infant death syndrome, known as SIDS, as you mentioned, is a tragic condition. It's the #1 leading cause of infant mortality in the U.S. In infants up to 12 months of age, and also the third leading cause of death amongst infants in the U.S. So this is really breakthrough in that we really didn't know why it occurred or what was happening, but researchers have found that an area of the brain called the dentate gyrus, really deep in the brain, may be implicated and may cause issues like respiratory depression or seizures or sleep-related deaths.
Is this a deformity, a mutation from genetic development? What is it about this this spot in the brain?
So the study really showed that there was some lesion. So it's really up to further research to really identify what lesion. But this is really breakthrough in just being able to identify infants that may be at risk.
This really could be important because SIDS has confounded the medical community and, of course, just ravaged those parents who have suffered through it.
Very much so. It's a tragic condition. So this is quite breakthrough.
All right, let's move on to our last topic, and that is, we know many of us are going to overeat tomorrow. First of all, let's just talk about how many calories do people typically eat on Thanksgiving?
Exactly. So Thanksgiving is such a wonderful holiday, getting together with family and friends and feasting. But surprisingly, an average American may consume anywhere from 3,000 to 4,500 calories on Thanksgiving Day.
Just in that one meal?
Completely, without even knowing it. A lot of it is snacking throughout the day and desserts, but really it's a whole calorie load.
And what's the danger of that from a medical perspective?
Well, I think overindulging on one day is one thing, but Thanksgiving's the start of the holiday season, so if this kind of continues, it can lead to a very poor pattern. And we know that, pounds that are packed on during the holiday season tend to stay on throughout the year.
So and it's very important for people to remember to take their blood pressure medicine, all their medication on that day, not get caught up in the festivity of the day.
Oh, so important, really, to be responsible, make right choices, but also enjoy.
All right. Yes, we have to be responsible, darn it. Dr. Fiona Gupta, thank you so much.
Thank you very much.
Appreciate having you here. And you're watching Arise America.
Please stay.